The American Cancer Society estimates more than 60,000 cases of oral, head, and neck cancer are diagnosed in the United States each year. That's why it's so important to know what causes this and take preventative measures to avoid it or catch it early. Dr. Brian Hickson is here with us today from Eastern Shore Ear, Nose, and Throat. Dr. Hickson, good morning. Thank you so much for being here.
Thanks for having me.
All right, so let's start with telling the folks a little bit about oral, head, and neck cancer. We mentioned 60,000 cases a year, but how common does that make this form of cancer?
It's a very common form of cancer, and one that as otolaryngologists or ear, nose, and throat surgeons we encounter almost daily.
Now, when you encounter it so much, one of the things I think folks want to know is how treatable is this form of cancer?
It's very treatable, especially if it's encountered early, at an early stage.
So let's talk about that then. What are some of the signs and symptoms that people need to be looking out for? What are some of the causes? All that important information.
Sure. So there's sort of two parts to that question. First of all, traditionally the demographic that we saw suffer from this cancer the most was those who smoke and drink alcohol, and that was the cause of more than 75% of these cancers. But in the last 20 years, we've seen an increase in the incidence of throat cancers, both from the tonsils and the tongue base, from a virus that everybody knows, which is the HPV or human papilloma virus. So whereas the overall incidence of head and neck cancer is decreasing, actually HPV-related throat cancers are increasing about 5% per year since 1990.
So what is the best way to avoid that? And again, what are some of the symptoms you want to look out for where you may say, oh, I got to get checked out? Sure,
absolutely. So signs of cancers in the mouth include things like a spot that won't heal or some bleeding in the mouth. Additional signs would be troubles breathing, swallowing, pain in the ear, also change in the voice or a mass in the neck that won't go away. And also more sort of systemic signs like weight loss that's unintentional and things like that.
Now, you mentioned catching it early can have huge consequences in terms of bettering your treatment for the future. Let's talk about this screening that's coming up that you guys are providing. Tell the folks what's taking place.
Absolutely. So we're partnering with the Gulf Coast Cancer Center and providing a free head and neck cancer screening in our clinic. We, as the Eastern Shore Ear, Nose, and Throat Clinic, opened a new office in Daphne, and so we will be hosting the event where we will screen as many folks as need to be screened over the course of an afternoon. It's going to be next Wednesday from 2 to 5 in the afternoon, and the exams will be performed by myself and Dr. Bill Hickson, who's a radiation oncologist with their group.
Just so people kind of know what to expect when they come out, what does the screening entail? What is the process?
So it will sort of be like an abbreviated visit that you would have with me if we had an appointment otherwise. So we'll do some basic history and background information, and then perform a physical exam and address any areas that are specifically are of concern. And then depending on the result of that, we can then follow up with formal appointments and things as need be.
Lastly, before we go here, you mentioned alcohol and tobacco use can have a huge impact in this, but is there a specific age group that people should know if they want to come out and get screened? Is there a higher frequency within certain ages?
It's certainly a disease we see more commonly in adults and specifically men, but in the case of something like thyroid cancer, we see that present very commonly in younger adults in 20s and 30s. So really there is no age that wouldn't have some impact by this screening.
In that case, a great opportunity for you to come on out, get screened, take a preventative measure, see where you're at. Good to check these things out beforehand before it gets to be too late. Thank you so much for coming in and sharing this information with us today.
Absolutely. Thank you.
All right, we're going to post more information on the Studio 10 tab on fox10tv.com.
We're finishing up.